Today we're going to look at the respiratory system. So the respiratory system involves interactions between the cardiovascular system and the respiratory system. In order to function, they need to cooperate. Their job is to supply oxygen to the body and eliminate the carbon dioxide waste. So this video is going to be multiple parts to cover this system because it is fairly long. So this first one, we're going to focus on the anatomy. So your respiratory system is our source for gas exchange, where the cardiovascular system is the transport. So if either one of the systems fails, you're going to have problems where you're not going to get adequate oxygen and waste will build up. Respiration is the exchange of the gases between the atmosphere and the blood and the cells. There's three main steps to this: ventilation or breathing, your external or pulmonary respiration, and then your internal or tissue respiration. So ventilation is the movement of the air in and out of the lungs. External respiration is the gas exchange between the air in the lungs and the blood. So in order for the next step to happen, you're going to have to transport that oxygen and carbon dioxide in the bloodstream. Then you have internal respiration, where gas exchange occurs between the blood and the tissues. Cellular respiration is going to look at how the cells use the oxygen to produce ATP. This is where you look at things like glycolysis, the TCA cycle or Krebs cycle, and the electron transport chain. So functions of the respiratory system, main one is gas exchange. So oxygen is going to enter the blood and carbon dioxide is going to leave. Along with this, it is going to help to regulate the pH. This is altered by looking at the blood carbon dioxide levels in the carbonic acid buffer system. Sound production is going to occur with the respiratory system. This is when you move the air past the vocal cords to create speech. Smell happens here. It's part of your nervous system as well, but smell occurs when those airborne molecules go into the nasal cavity. And then thermoregulation, heating and cooling the body. In humans, this is not a huge process. We have other ways of heating and cooling the body. But if you look at your dog when it's warm, panting is a big source of thermoregulation for them. And then we have some protection against microbes that would come in this way. So we need to have means of removing them. We do that with cilia largely to help haul them out. So the components, we have the upper and lower respiratory system. The upper is the portion that's above the vocal cords. The lower is below. We typically use that designation if we're talking about trying to say where a respiratory infection is. So if you've got an upper respiratory infection, it's going to primarily be in the nose. The conducting system is going to consist of a series of cavities and tubes. So this would be your nose, pharynx, larynx, trachea, bronchi, bronchioles, terminal bronchioles, any place that conducts air into the lungs. And then your respiratory portion is where you actually have the gas exchange occurring. This would be your respiratory bronchioles, alveolar ducts, alveolar sacs, and alveoli. So this picture here gives an illustration showing the division of upper and lower respiratory systems. So with the nose, the external portion is made up of cartilage and skin, and then it's lined with mucous membranes. And then the external nares are your openings to the outside. The bony framework is also formed by the frontal bone, the nasal bones, and the maxillae. When we look at the internal nose, you've got a large chamber that's within the skull. And the job of this is to warm and moisten the air and help filter it before it comes in. It will receive your olfactory stimuli. And then it's a large, hollow resonating chamber where you're going to help to modify speech for sounds. So the roof is made up by the ethmoid bone, the floor, the hard palate. The internal nares are going to be where you have the chonae. They're openings to the pharynx. And then the conchae are the bony swellings on the lateral walls. It is divided into right and left parts with the nasal septum that's made up of bone and cartilage. It will communicate with the paranasal sinuses and the nasopharynx through those internal nares. So your paranasal sinuses are to help lighten the skull and give resonance to the voice. One of the things you notice when you do have respiratory congestion is there is some changes to your voice. We call both the internal and external nose part of the nasal cavity, and we just divide it into right and left portions with the nasal septum. The vestibule is your anterior portion of the nasal cavity, and nasal polyps are outgrowths of the mucous membranes. These are usually found in the openings of the paranasal sinuses. So we have a picture here showing, here you can see where those nasal conchae are going back as part of the vestibule out here in front. Sphenoid sinus, your internal nares back here, going into the nasopharynx. This one also allows you to see the path that air would flow in. So it can either come in through the mouth or the nose. The nose really is there for taking air in more so than the mouth. I'm bringing it back in, and you can see how it connects going down. So the pharynx is a 5-inch muscular tube that hangs from the skull. It's skeletal muscle lined by mucous membrane lining, and it's going to go from the internal nares to the cricoid cartilage. This is a passageway to move food and air, and then a resonating chamber again for speech production. Your tonsils are lymphatic tissue. They're located in the walls, and they help to protect the entryway into the body. So there's 3 distinct regions here, and this picture here divides these regions for you: your nasopharynx, your oropharynx, and laryngopharynx. The nasopharynx is associated with respiratory function, where the oropharynx and laryngopharynx are going to do both respiratory and digestive functions. So the nasopharynx is going to go from the choanae to the soft palate. You'll have your openings to the auditory or eustachian tubes that will connect in that area. The adenoids or pharyngeal tonsils are located in the roof. So this is just a passageway for air that will be lined with pseudostratified ciliated columnar epithelium and goblet cells. Oropharynx is going to go from the soft palate down to the epiglottis. The fauces are openings from the mouth to the oropharynx. And then your palatine or lingual tonsils are going to be found in the side walls and in the tongue. So this provides a common passageway for both food and air and is lined with stratified squamous epithelium. Then the laryngopharynx is going to go from the epiglottis down to the cricoid cartilage. It will provide a common passageway for food and air, and it ends as the esophagus on the inferior portion, and it's lined with stratified squamous epithelium. And then your larynx is a passageway that's going to connect the pharynx and the trachea. So here you'll have the thyroid cartilage or Adam's apple, the epiglottis. The epiglottis is going to prevent food from going into the larynx. The cricoid cartilage that's going to connect the larynx and trachea, and the pararytenoid, carniculate, and cuneiform cartilages. So this color code's showing the different regions of the throat there. So voice production does occur in the larynx. You've got your true vocal cords or vocal folds that produce sound, and then you have taut vocal folds that will produce high-pitched sounds. Relaxed vocal cords will produce the lower-pitched sounds. And then the other structures help to modify the sounds. So the cartilages of the larynx, you've got the thyroid cartilage that's going to form the Adam's apple. The epiglottis is going to be a leaf-shaped piece of cartilage. The larynx is going to move upward during swallowing, and that's going to allow the epiglottis to bend down and cover the glottis to keep food from going into the airway. So these pictures here show these different cartilages in the throat. So we've got the epiglottis here. So the cricoid cartilage is going to be a ring of cartilage attached to the top of the trachea. And then you've got your pararytenoid cartilage that sit on top of it. So your false vocal cords or ventricular folds are going to be found above the true vocal cords. Those true vocal cords attach to the arytenoid cartilages, And they're going to have skeletal muscle as well as an elastic ligament, your vocal ligament. There are the 10 intrinsic muscles of the larynx that will contract, and those move the cartilages and stretch the vocal cords tight. So when air gets pushed past that tight ligament, sound is produced. The vocal cords are longer and thicker in males to produce a lower pitch of sound. So the tighter the ligament, the higher the pitch. If you want a louder sound, you just have to push the air harder. So again, this is another view of where all of these cartilages are in the throat on a sagittal plane. This is showing here the vocal cords. So you've got the true vocal cords here, and then your false vocal cords out there. This is an actual photograph of the vocal cords. This allows you to see the difference in the position of the vocal cords when they're open for breathing versus when they are speaking. And this is the direction that you change the tension of the cords. So speech is a modified sound that's produced by the larynx. It does require the pharynx, mouth, nasal cavity, and sinuses to create the resonation and the speech. The tongue and the lips help in forming the words. Pitch controlled by the tension on the cords. So tighter tension, higher pitch. In males, vocal cords are thicker and longer, so it's a slower vibration with a lower pitch sound. When a person whispers, they're forcing air through an almost closed glottis. So the rima glottitis. So your oral cavity alone forms the speech when you're whispering. Your trachea, it's 5 inches long and 1 inch in diameter. It's going to go from the larynx down to about the level of T5. It's located anterior to the esophagus, and then it's going to spread into the bronchi. And it's got different layers to it. This is a cross-section here that allows you to see, here you've got the esophagus, here you've got the trachea. This is the posterior side over here. So the mucosa is going to have pseudostratified ciliated columnar epithelium with goblet cells to produce mucus. The submucosa will be loose connective tissue and seromucous glands. Your hyaline cartilage, you've got 16 to 20 incomplete rings. The job of these rings is to keep the airway open. You can actually feel them in your own throat from the outside. The open side faces the esophagus and is going to have the trachealis muscle in there. The internal ridge on the last ring is the carina, and then the adventitia is going to bind it to the other organs. So your airway epithelium are going to be ciliated pseudostratified columnar epithelium along with those goblet cells. So here you can see the cilia on this picture of this type of epithelia. And then you've got the goblet cells. So if a person loses airflow, it is important to reestablish airflow and open up the airway. Things that could cause this: a crushing injury to the chest or the larynx, swelling that closes the airway, vomiting, or some other foreign object getting stuck in the airway. So the tracheostomy is when an incision is placed below the cricoid cartilage if the larynx is obstructed. Intubation is a much gentler process for the patient. A tube is passed through the mouth or nose into the larynx and the trachea. So if intubation is done properly, there should not be damage to the patient. The bronchi are going to divide into right and left pulmonary bronchi from the trachea. So the tracheobronchial tree is going to have your trachea, that would be your trunk. It's going to fork into the primary bronchi. Those form into secondaries, those into tertiaries, then the bronchioles and terminal bronchioles. You're going to have different tissue makeups as you go throughout the tree. The walls of the bronchi will contain rings of cartilage, where the bronchioles are going to have smooth muscle. This allows for bronchoconstriction. So here you can see it literally forks and forms like a tree. So the epithelium is going to change from pseudostratified ciliated columnar to non-ciliated simple cuboidal as you pass deeper into the lungs. The incomplete rings of cartilage will get replaced by smooth muscle and then connective tissue. Your sympathetic nervous system and adrenal glands can release epinephrine that will help to relax the muscle and dilate the airways. So when a person is having an allergic attack or an asthma attack, a lot of times something like epinephrine can be used to help open up those airways in there because they will constrict with an allergic or asthmatic reaction. Nebulizers, with those you inhale the mist, and there's a chemical in there that helps to relax the muscle and reduce the thickness of the mucus. So at the bronchial tree, the non-acinous portion is your conducting zone. Here, the trachea is going to go to the terminal bronchioles. They're ciliated to help remove the mucus and debris. It's a passageway for air movement, but it's going to be controlled by smooth muscle at the end of the terminal bronchioles. The tubes are held open with cartilage, and then the smooth muscle will control the tube diameter. In the acinous portion, it's the respiratory zone. You have your respiratory bronchioles to the alveoli make this up. This is where gas exchange occurs. There's actually a lot of surface area in here. It's about the size of a football field. So we have pleural membranes. So the visceral pleura is going to cover the lungs. The parietal pleura is going to line the rib cage and cover the surface of the diaphragm. And then the pleural cavity is the potential space between those layers, and it's going to have lubricating fluid in there that is going to come from the pleural membranes. So if this is collapsed, you could have pneumothorax or hemothorax. So this allows you to see a transverse cut of the body where you can see where the lungs are and the potential space of those different layers, your pericardial cavity, the visceral pericardium. So with the lungs, the right lung has 3 lobes that are separated by 2 fissures. The left lung has 2 lobes separated by 1 fissure and the presence of the cardiac notch. The reason for the difference is because the heart does sit off to the left side. The secondary bronchi are going to lead to your tertiary or segmental bronchi, and those supply the different segments of the lungs. So those are your bronchopulmonary segments, and each of these will have many small lobules that will have lymphatics, arterioles, venules, terminal bronchioles, respiratory bronchioles, alveolar ducts and sacs, and the alveoli themselves. So when we look at the mediastinal surface, here you can see where you've got the hilus. This is going to be where the blood vessels and airways enter the lungs, and it forms the root of the lungs. This is going to be covered with parietal pleura. So within the lung lobule, you've got branching of a single arteriole, venule, and bronchiole that are wrapped by elastic connective tissue. So in your respiratory bronchioles, you're going to have simple squamous epithelium. And then when you get to the alveolar ducts, they're surrounded by alveolar sacs and alveoli. The sac is just 2 or more alveoli that share a common opening. So this here allows you to see alveolar ducts, and then you've got the alveolar sacs, and then this is an actual tissue picture to go along with the illustration. And here you can see where these are located, one that is in different colors. And again, you've got the lobule here, the alveoli. And this is showing the capillary network that's going to cover an alveolus. So we have different cell types in there. So the type 1 are alveolar cells. They are simple squamous cells. This is going to be where gas exchange occurs. The type 2 alveolar cells or septal cells, the free surface has microvilli on these. So these are going to secrete alveolar fluid and have surfactant. And then you've got your alveolar dust cells, which are wandering macrophages that are going to help to remove debris that ends up in the lungs. So we can see here, here's one of those dust cells or alveolar macrophages, your type 2 septal cells, and then your type 1 alveolar cells. So your alveolar capillary or respiratory membrane is about a ½ micron thick. This is where you're going to have the exchange of gas from the alveoli to the blood, and you have a vast amount of surface area here. So there's 4 layers of membrane to cross. You've got your alveolar epithelial wall of the type 1 cells, the alveolar epithelial basement membrane, the capillary basement membrane, and the endothelial cells of the capillary. So this is allowing you to see those different layers here where you're going to have oxygen and carbon dioxide diffusing in and out. So when we look at the blood supply to the lungs, the conducting portion is going to be supplied by the systemic circuit. So it's going to bring oxygenated blood to it. Here is trying to feed the lung tissues with the oxygen. It's going to get its blood from the external carotids, the thyrocervical and bronchial arteries. The respiratory exchange portion is going to be supplied by the pulmonary circuit. So it's going to have deoxygenated blood. So this is the source of the angiotensin converting enzyme. Your pulmonary veins are going to return the blood back to the left atrium. So you have ventilation perfusion coupling going on. The pulmonary blood vessels constrict in response to low oxygen. They do this so they don't pick up carbon dioxide on their way through the lungs. So the respiration portion we will pick up in another video.